A new report brings us numbers to show just how much the pandemic exacerbated alcohol, drug, and suicide-related deaths in 2020.
The report comes from Trust for America's Health. It's a nonprofit, nonpartisan organization based in Washington, D.C. that focuses on preventing injury and illness. A spokesperson says for the last 5 years, the numbers of these types of deaths have gone up each year. In Maine, alcohol-induced deaths went up 50% from 2019 to 2020. Drug-induced deaths went up by 30%. Suicides, however, decreased by 16%. The researchers say the social isolation, financial stress, and grief from the pandemic increased the risk for substance abuse.
Behind every statistic is a grieving family. It's a life that's been lost. We have policies that work. We know what works when it comes to substance abuse prevention and suicide prevention. So now what we need to do is put those programs in place, make those investments.
Now, this report also poses a number of recommendations.
Nearly all of them focus on harm reduction, increasing access to mental health, behavioral health, drug courts, recovery programs, and naloxone. Maine is already putting many of those practices into place, and people are seeing their value and supporting them.
York Hospital's Recovery Center has received hundreds of thousands of dollars in donations and federal funding since the start of this year to expand its programs. And recently I got an inside look.
It's difficult to find people who haven't been touched by the substance use disorder.
This epidemic touches all of us, directly or indirectly.
I have family members who are in recovery from substance use disorders.
Sometimes it takes us by surprise.
I was actually finding that some of my patients who I thought I knew well actually were struggling, and we didn't even know it for a long time.
Dr. Christine Monroe is a pediatrician at York Hospital. She also runs the medication-assisted treatment program at the hospital's Substance Use Recovery Center.
That I never have to tell somebody that they can't have medicine today. The shoulders relax, the face relax, and just an expression of thanks.
That's because of gifts like these. A $5,000 grant from a local church to buy 500 doses of the medication that helps people wean off of opioids. A $25,000 donation from a local bank to build a new hybrid counseling room.
This is the medical appointment side of things.
And $155,000 in congressionally directed spending for the center to further its work.
Is it making you emotional to talk about?
I am emotional about it.
Why?
It's a trust thing. If I can make them feel better today, then I know that they'll come back tomorrow because they can trust it. And unfortunately, a lot of times when we finally do get patients in the room, they haven't heard this before from other people. When no one else knows what to do, I can do something, and that feels good.
These dollar amounts I get are small for some institutions or systems, but for us that's not true. It makes me feel heard.
It makes you feel proud, I think. Like people care about you. Like that it's worth it. That your life has value and that it's worth the hard work that it takes.
For more than a year now, York Hospital's pharmacy also has the overdose reversal drug naloxone available with no prescription needed. And that is one of those recommendations from that report we told you about, increasing access to that life-saving medicine.